Hello, welcome to Synchronicity, talk radio for your mind, body, and soul. I'm your host, Marie Benard, and you may be watching this on YouTube or listening on CITR 101.9 FM, where we broadcast live from unceded Musqueam territory in the city of Vancouver on the University of British Columbia campus. Or you might be listening online at citr.ca, cosmicdimensions.com, empowerradio.com, or on the Co-Creator Network. And wherever you're listening from, thank you for being with us today. And today's guest, I hope that this is going to help you. If you suffer from any kind of pain, you're going to want to listen intently to this episode. We're joined today by Dr. David Hanscom. He's one of the top orthopedic complex spine surgeons in Seattle, Washington. And evolving from his own 15-year experience with chronic pain, he learned to help hundreds of patients become pain-free using a largely self-directed, structured approach. And most patients did not end up requiring surgery. He is the author of Back in Control, a spine surgeon's roadmap out of chronic pain. Welcome to the show, David.
Great. Thank you for that very nice introduction. I appreciate that.
Thanks for being with us today. So you are a spine surgeon and you've written this book to help people. Hopefully they won't end up with spine surgery. So you're trying to put yourself out of business or what?
Well, I sort of am putting myself out of business a little bit. This year is actually my 30th year doing spine surgery, which is mind-boggling. It goes by very, very quickly, as we all know. But I spent my first 8 years in practice aggressively performing spine surgery for almost everything. And when you come out of training, you feel obligated to help people with surgery because everything else has been tried. And there's sort of a general feeling that, well, everything else has been tried, surgery is sort of the final answer. Well, it turns out that surgery is only the final answer if you can see the problem. So for instance, if you operate just on pain and don't have an identifiable source that's really clear, the chance of success for a spine fusion for back pain, which is very nonspecific pain, is about 25%. It's not very high. So it took me 8 years of practice to understand that data. And when I found that data out around 1993, I simply quit doing spine surgery for back pain. And for about 10 years, I didn't have any alternatives. I had no idea what to do. At the same time, I was in severe chronic pain myself, and I barely made it through. And in 2003, I sort of popped out of the pain pathways, and the last 10 years have just been incredible. But I've been on both sides of this fence, being an aggressive surgeon and now learning how to treat people without surgery.
So you were experiencing your own chronic pain. Was that back pain?
Well, what happens when you're in chronic pain, you're trapped, and you're not very happy about it. So your body becomes full of adrenaline. There's over 30 symptoms of what we call mind-body syndrome, and I had 16 of those symptoms at the same time. So I had migraine headaches, I had ringing in my ears, I had back pain, I had anxiety, insomnia, I had burning in my feet, skin rashes, itching scalp. I had an endless array of these symptoms, and I had no idea what was going on. And once I came out of these pain pathways, which again, at the time, I didn't actually know what happened, all the symptoms disappeared. So I'm fine. But I was in chronic pain for 15 years. Actually, if you count the migraines, they actually started when I was 5 years old. The anxiety actually started when I was about 22, 24, but I suppressed it. So, I mean, really my whole life, I've been in chronic pain with really severe migraines my whole life. I haven't had a severe migraine in about 7 years now. And I had them every 2 or 3 weeks that were just crippling. So yeah, I mean, my journey in chronic pain has been extreme. I would not take this gift again, but the gift I was given was chronic pain. And I can look any patient in the eye and say, look, you may be suffering as much as I did, but not more. And I just about didn't make it through. I mean, it's really extreme.
And when you say you almost didn't make it through, what do you mean by that?
Well, I'm pretty clear in my book and my website. I was actively suicidal in 2002, 2003. And unfortunately, chronic pain, suicide is actually a big problem. I mean, it's so miserable and you're so hopeless and so trapped. It's just indescribable. And I get it. I mean, the experience is so bad. I just can't put out. I mean, you have no way out. I mean, you just don't know what to do. And you have no idea what's happening to you. These physical symptoms are just horrible. And I didn't become a major spine surgeon by having anxiety. I mean, I just didn't. So when I trained for spine surgery, I was going 1,000 miles an hour. I completely suppressed anxiety. My first hint I even had anxiety was I was 40 years old. I was driving across the 520 bridge here in Seattle, and I had a panic attack. And I'm going, what is this? I had no idea what was going on. And I didn't know what a panic attack was. I never heard of it. I had no idea what was happening. And from that point on, I just went into a 13-year tailspin that was just indescribable. So 7 of those 15 years were extreme. It was unbelievable. So for 7 of those years, in 1997, I was reading a Seattle Times article about obsessive compulsive disorder. And I was reading about this disorder. I go, wait a second, that is me. And it was. It was called internal OCD. So instead of having external manifestations like repetitive activities like hand washing, etc., you have internal thought versus counter thought. They call it internal OCD. And OCD is considered untreatable. And I was, again, extreme anxiety is intolerable. And OCD is the ultimate anxiety disorder. And again, it's just miserable, tormenting mental pain. And it's considered untreatable. You manage symptoms and do different things for it. And I tried everything. But, I've been fine for at least 12, 13 years. I've been just fine. Actually, more than fine, I'm thriving. So it's been a gift in an odd way, I guess.
Awesome. Now, you actually mentioned in your book how your story of pain, on the one hand, sometimes we think that our story is to help other people, but actually we're just further perpetuating our victimhood. Can you say more about what you mean by that?
Well, I put on a seminar in New York. We've done 3 of those so far. I do this with Dr. Luskin and my wife back in Omega. And what we inadvertently realize is that when you're in pain, you tend to discuss it a lot with people. I mean, it's occupying your life. It's a topic of a conversation. People want to know how you're doing. Your life becomes full of doctor's appointments, et cetera, et cetera. Well, unfortunately, what you're doing is simply reinforcing the pain pathways. And then Dr. Luskin points out in his book, Forgive for Good, if you tell a story 3 times with a similar theme, and you're the victim of that story, he calls it a grievance story. And the more times you tell it, the more real it becomes. It becomes basically your reality. So yeah, one of the rules we did at Omega is they simply could not talk about your pain. And I hadn't realized until we did that seminar how much people actually do talk about their pain. But yeah, one of the major treatment modalities we use, you say, look, you can find one person to discuss your pain with, maybe 15 minutes a day, and that's it, done. They've also done research showing that one of the negative prognostic factors for chronic pain is actually keeping a pain diary. Because again, your consciousness is on those pathways.
Now, just can we take a step back, because listeners and viewers might not know what Omega is?
So Omega is a 200-acre resort in New York, and we held a 5-day workshop called Rewire Your Brain to Unlearn Your Pain. So I did the didactic part. We find out that forgiveness is a huge part of chronic pain, because people in chronic pain are trapped. They're legitimate victims, and they're very angry. And of course, the more angry you are, the higher your adrenaline levels, which makes the pain worse. So Dr. Luskin wrote a book called Forgive for Good out of Stanford, and he and I put on the didactic part of the seminar. What my wife did, she's a professional tap dancer. And so what inadvertently happened, which we hadn't really anticipated, is that about 4 years ago, I realized that pain pathways are permanent, but so are play pathways. You don't have to make those up. They already exist. And so the essence of solving chronic pain is that there are permanent embedded pathways, just like an athlete or artist learning a skill. And the more you talk about them, the worse they get. It's like riding a bicycle, they're permanent. So the alternative is to create new pathways around the old pathways, but you can also shift. It's like diverting a river into a different channel. So what my wife did is that she developed these simple foot rhythms, hand rhythms. And what turned out to be one of the most effective parts of the process was a song called the Cup Song. Have you heard of the Cup Song by chance? It's on the internet. And it was popularized about, Pitch Perfect was a movie that popularized the cup song. And anyway, we just learned a little hand rhythm called the cup song, and people just started to laugh. And within 2 or 3 days, about half the group went pain-free. And by the end of the week, essentially all the group went pain-free. And then when people went back to their environment and became re-triggered by their environment, about a third of them went back into their pain pathways. But over half to 2/3 have remained pain-free for many years. So we didn't expect that either. But anyway, that was our workshop. Vegas is simply a place where we held a workshop.
Awesome. So you actually had sent me a link to an article you wrote for a website because you have a different view about positive thinking, and it sounds like your article, you can't just if you don't acknowledge you probably explain it way better than I do. I'll leave it for you.
I've written this in multiple different ways, and there's two things that simply do not work in chronic pain. One of them is positive thinking, and the other one is mind over matter. Because what happens, pain is part of the unconscious part of the brain, and it's estimated that the unconscious part of the brain is 1,000,000 times stronger than the conscious brain. So if you try to fix and deal with these anxiety pathways, which again are eliciting the body's full chemical response, you have no chance. So the conscious part of the brain really cannot link to that whole process. So what happens with positive thinking, it's really just another way of, with positive thinking, really just suppressing negative thinking. And if something, nobody is asking you to be happy about your pain. But when you try not to think about something, of course, you think about it more. So what happens is that we call it, there's more and more research on this, but they call it leaning into the negative. You have to truly understand what's the negative part of your brain and acknowledge it, because none of us like anxiety. None of us like anger. We don't like ourselves. We don't like the feeling. We put a wall up between ourselves and this back room of emotions that we don't like. So what happens is it takes a tremendous amount of energy over the years to keep that door shut, and then it starts popping out in a way that we can't control. So by we call it leaning into the negative, you now can then substitute. There's 3 parts of what we call reprogramming or rewiring the brain. And by the way, in chronic pain, the brain actually physically shrinks. That's been documented in multiple studies. And when you treat chronic pain successfully, it actually re-expands. And they have now very sophisticated neurological imaging that can really delineate these pathways very, very carefully. It's very interesting. So, and the changes happen very quickly. Within 5 to 10 days, things actually start to change. So the sequence is awareness, separation, reprogramming. And what happens, we start with a process called negative writing. We simply write down negative thoughts, and you have now separated from them. So you become aware of the negative. You have now physically separated from those, which connects to the unconscious part of the brain. Then positive substitution is the essence of the solution. So once you can lean into the negative, then you can separate. Then when it's mindfulness, meditation, acupuncture, play, relaxation, all those techniques work once you quit fighting the negative. Was that reasonably clear?
I think so, yeah. So when you're talking about awareness, because you mentioned yourself that you had all of this anxiety and which was causing the pain. Right. So are you talking about awareness of the pain or awareness of that root issue?
Well, when people do the writing, I always counsel them, say, look, when you write, all these issues are going to come up, right? You write down negativity, your pen's flowing freely, a lot of negative stuff comes flowing out. I tell people, look, these are not issues. In other words, you cannot change the past. You can't change the links to the past. So all the writing does is simply separate you. So when people try to solve and analyze these issues, again, you're paying more attention to the pathways. That doesn't work. So the writing is simply a separation process, allows you to de-journalize a little bit. I call it mechanical meditation. Again, then you can substitute. So that's sort of the sequence that's been the most effective. So the other thing is, these pain pathways are permanent, but we also found out that play pathways are permanent. So again, between the writing and simply enjoying the day, all of a sudden your brain starts shifting back into a different spot. So again, it's not positive thinking, but it's definitely positive substitution.
Awesome. Thank you. And so it sounds like you have been this physical surgeon doctor, and now it sounds like you're focusing more on the mental and emotional and neurological aspects of the body.
I just wrote an article for an international spine journal called the Global Spine Journal, and I reviewed a lot of articles looking at the different effects of sleep and stress on pain. And there are hundreds of research articles that demonstrate that. In fact, it shows that lack of sleep has actually more effect on your disability than the actual amount of pain. And so, the first thing in the book that we address, of course, is sleep. And
is that your phone?
It is. I'm sorry.
Yeah.
I'll just get rid of that. Let me say that again. So we find out that, for instance, in the book, that lack of sleep is actually more a predictor of disability than the actual amount of pain. So I look to treating chronic pain similar to putting out a forest fire. So what you're trying to do is take away the fuel. So lack of sleep, of course, is fuel for the fire. When you're anxious, it actually increases the adrenaline, which increases the pain. So that's fuel. When you're angry and trapped by pain, that really cranks up the adrenaline. So again, more fuel for the fire. So as you address the sleep and calm down the nervous system, again, you start decreasing the pain. But remember, you have to tackle a forest fire from multiple different directions. So you're dumping water and flame retardants on the fire. Those could be similar. This medication management is part of the process. So as far as getting better, the first step is simply learning about chronic pain. That's a neurological issue. The second part is you treat every variable at the same time. It's an additive effect. Then the third part is once you understand the pain, once you understand your variables, then you take control of your own care. You're in charge. So just taking control actually decreases your anxiety because you're not trapped anymore. So what's happened now with all of our surgical patients that we actually, for every patient that comes into my practice, we say, look, even if there's a surgical problem, we're going to work on these tools for 8 to 12 weeks before we do surgery. I now have 52 patients who are writing a research paper on that they were on the surgical schedules. They had major structural problems. They would come in for their preoperative appointment and they would cancel the surgery because their pain disappeared. So even with surgical problems, as you calm down the nervous system, we think you're raising the pain threshold, they don't feel the pain. So the goal here is not managing the pain, it's not living with the pain. People do go to pain-free.
Wow.
My record person is 55 years of chronic pain. She's been pain-free for a couple of years. So it doesn't matter how long you've had the pain. Once you can reconnect with the play pathways, once you can de-adrenalize your nervous system, the pain really does disappear.
Now, is the woman that you spoke about, is that there's an article mentioned here in your promo, and she was in pain and in a wheelchair for more than 10 years. Is that her?
This is a different person. So the one I'm talking about had been in chronic pain for 55 years. She happened to read the book, start the writing, and within about 6 months, she blew out of her pathways. And they remember with all this stuff that, life is variable, the pain is variable. She went up and down initially. And I still go up and down. In other words, there's never a permanent solution, but you learn not to stay in the pathways as long. You come out more quickly. So it's a learned skill. And she, the last year has been just incredible, becoming very skilled at coming back out of her pain path very, very quickly. The person you're referring to is a woman who had a car accident in 2001, some marital issues. She slipped and fell in a store, had a lawsuit. And by 2004, she had total body pain. And she had a couple of surgeries along the way and had been in a wheelchair since 2004. And I started to work with her. She wasn't really engaging very much. So basically my colleague and I fired her, said, look, not really helping you out. Really your choice to help yourself out. We can help you, but we can't really help you out. She came back about 6 months later. I saw her name on the schedule. I'm going, oh, brother, I wasn't really anxious to see her. So I walked in the room and there was no cane, no crutches, no wheelchair, nothing. She stood up and simply walking around the room normally and no pain medications. So she admitted that she'd been sitting in her room obsessing about everything for 10 years. And she was in a very small, dark world. And she realized after reading the book that the problem with her is that she's incredibly angry, and she decided she did not want to do that anymore. So she read Dr. Luskin's book. She took some anger management classes. And with about 6 months after she started the process, she went to pain-free. And she's
Wow.
been out of the wheelchair now for a couple of years. But no, she's fine. I mean, she is back doing hobbies, out and about doing normal things. So, I mean, again, for me as a surgeon, I'm used to doing surgery to fix people. And, I saw 3 people today, again, same thing, people that I would consider non-salvageable situations. And they came into my office today, and they're fine. They're doing great. And of course, they're so excited. So I get excited. So no, it's really exciting to watch this happen. I mean, these are people. I mean, when I give lectures on chronic pain to my peers and ask my colleagues, how many of you enjoy managing chronic pain? What do you think? What do you think the audience response might be?
Not very much.
No, it's less than 5%. And it's not because the doctors are bad people. It's that, and I'm the same way. I mean, I just wasn't trained. I mean, nobody trained me in how to deal with chronic pain. So we do little medications. Patients get frustrated with us. We get frustrated with them. And so it's not historically for me or anybody else in the medical field been a very enjoyable experience. So I gave a lecture at the Mayo Clinic about 3 years ago on enjoying the management of chronic pain. It's been by far and away the most rewarding phase of my career. And that's my personal goal, is to bring this stuff right into mainstream medicine, because the literature actually documents what I'm doing. In other words, I don't look at my book as the ultimate answer. My book is just a framework that presents literature that's it's already been documented to work. And so the book provides a framework for people to find their own solutions. In other words, you're not going to read my book and go to pain-free. Hopefully you can read the book and realize, okay, I got to deal with the sleep. I got to decrease the anxiety. We'll adjust medication. And as you take control of these variables, I mean, it's very, very consistent. Probably 90 to 95% of the time, people get better. Now, a lot of people don't want to do that, which is, I can't do much about that. So I just have to let go very quickly. And if they come back, of course, I'm open to helping them. But the one factor that predicts success is simply people's willingness to engage. And once they engage, it's just a matter of time. Been very consistent.
Wow. So it sounds like, I mean, we hear about people who have pain and then they're accused of it's all in their head. It sounds almost like that's kind of true.
So think about this carefully. So the reason why you can smell is because your nose picks up molecules that's interpreted by your brain, by your nervous system, right? So if you didn't have a nervous system interpret those signals, you would not have any smell. Same thing with taste, vision, and hearing. It's only because your nervous system interprets those signals that you actually have those senses. So same thing with pain. You have all these pain receptors on the skin. So when I touch this table, the reason why I'm not pulling my hand away is because my brain is not saying that this table is hot. There's some people whose brains are cross-wired enough that they actually can barely touch a table or have anything touch their skin. It's called reflex sympathetic dystrophy. So it's not that pain's imaginary, it's just that the set point has changed. And again, that's a whole cross-wiring technique. So all sensations are all interpreted in your brain. And it's interesting that modern medicine is, I guess it was, a couple centuries ago, somebody decided to split up the mind and the body. And the cognitive scientists have known for decades that is simply a unit. Like, for example, in your muscles, tendons, and ligaments, or the soft tissue, there's about 1 million pain receptors per square inch. 1 million. Wow. So your nervous system is completely embedded in your body and vice versa. There's simply zero separation. Your brain happens to be the housing unit for the nervous system. That's all. So it could be in your big toe, it could be in your stomach, it happens to be in your skull. But all those receptors from all the sensations simply go to the brain, and the brain has to interpret those and give you feedback. It's an incredibly delicate, balanced system. So that's a long answer to saying, yes, pain is only interpreted in your brain. That's it. Now, it can be a structural source, which we understand. If you have inflammation of a tendon, again, with 1 million pain fibers per square inch, that's a lot of pain. We also know that within 3 to 6 months on these new MRI scans that the brain actually memorizes the pain.
Did you say MRI? You spoke really quickly there.
On these functional MRI scans, which shows brain activity in different parts of the brain, that within 3 to 6 months, the activity switches from the pain center to the emotional center. In other words, you have the same pain, but a completely different part of the brain is driving the symptoms. And you can't tell the difference. In other words, you still feel the back pain, but the driver is no longer the pain center. Your brain has memorized the pain.
Wow.
And then the longer the pain goes on, it gets more and more cross-wired because that pain, remember, pain is a physical link to the environment that protects you, correct? Thoughts also protect you from danger. Both of those are connected to the brain, which gives you a response that gives adrenaline and anxiety. So whether it's physical pain or mental pain, the body treats those the same way. We look at mental pain and physical pain as exactly the same thing. They have the exact same physiologic response from the body. It's the same thing. So with repetition in time, thoughts are now connected to pain. And they're finding out with repetition that the complexity of chronic pain becomes more complicated. We also know by sheer repetition, just like an athlete learns a skill with repetition, your brain learns how to process pain more efficiently, and the pain always gets worse with time. Even though there's no structural changes, just with repetition, your pain gets worse over time.
Wow. We are speaking right now with Dr. David Hanscom, medical doctor, spine surgeon, and he is the author of Back in Control, a spine surgeon's roadmap out of chronic pain. And I really love the way that you're talking about neuroplasticity, and it sounds like you mentioned earlier in the show how people in pain, I've been dealing with some back pain myself lately, and it's true that because it's so much on the forefront of what's going on and it impacts so many parts of your life that we tend to just talk about it even if we're not obsessing about it. It's like, oh, how are you doing? Oh, well, I'm in pain, but I'm doing okay. And
Right.
it always seems to be this mention of the pain. I have a friend who I get on the phone with her, and sometimes I have to actually pull the phone away because she will go into explicit detail of every gruesome sensation she's experiencing, and I start to feel it. So I can't listen because just hearing her describe it, I start to feel the symptoms. What's going on there when that happens?
Yeah, that's called mirror neurons. That's actually a big deal. When I have a patient that I would like to participate in the project, I always ask the spouse or significant other to participate. So it's called mirror neurons. That what's happening is your friend's complaints are actually stimulating that part of your brain. And so they've done studies showing that when you smile at a baby, the baby smiles back. It's not because the baby's happy, you just stimulated that part of the baby's brain. Or when the football fans are watching a quarterback throw a ball down the field, it's the throwing center in the fan's brain actually gets stimulated. So it's how we learn by imitation. Mirror neurons is how we actually learn. So when you walk in you probably notice this with your significant other or spouse, is that if they're having a bad day, what's your day like? Not great, right? And when I talk to my spouse, talk to my patients, and I talk to the spouse, say, look, when your spouse is having a bad day, what's your day like? And people just roll their eyes. Because people in chronic pain are often not very happy. They tend to target their family as their sources of frustration. And I have endless conversations with families say, look, your anger comes into the household. It's this mirror neuron effect that wipes out the whole household. So your job, if you want support from your family, is to be a source of peace, love, and joy, which isn't so easy to do, by the way, when you're in chronic pain. But that's how you got to flip that around because you want the mirror neurons to go back the other direction. So I say, look to the spouse. If you really want to help your spouse in pain or significant other in pain, go through the process yourself, Start the writing, start the relaxation, start all the tools. Just use the word stress instead of the word pain. It's the exact same model. And the best way to help your spouse heal is actually become more healthy yourself. So yeah, your mirror is what you're feeling is real pain because your brain actually is firing away. So if we did a research MRI scan or a functional MRI scan on your brain, the part of your brain that relates to her pain actually would light up. That's
Especially
interesting.
because she describes she's very good at describing it.
Right.
So you start to picture it and sense it. It's not just like, oh, I'm in pain, it's uncomfortable. I can envision what's happening.
Well, she's a classic scenario. I mean, think about that. I mean, that's what most of my patients in chronic pain do, including myself historically, is again, when you talk about your pain and monitor it, where's your nervous system? You're not doing your hobbies. You're not talking to your friends. You're not relaxed. You're not having a good time. So it's a really a horrible downward spiral. And it's hard. I'm sorry. When you're in the downward spiral, it's hard to get people to engage. So if you're in the downward spiral and engage, you'll do great. But the problem is that whirlpool of thoughts actually blocks comprehension and actually blocks awareness. So it's hard for them to absorb the concepts to actually start the process. So again, going back to this negative writing, it's been the one common denominator of the whole project is simply writing down these racing thoughts, write down the negative thoughts, and we have patients immediately tear them up. And the reason why we have them tear them up is not for a catharsis type process. It's just so they can write with absolute freedom. The darker the thoughts that you can get on the paper, the more effective the process. So I call it mechanical meditation. It's the one thing that seems to break through these obsessive circuits.
Okay, let's talk more about that because, yeah, I think that comes back to you talking about how positive thinking doesn't work because sometimes I'll have a really dark thought and if I catch it, I'll be like, wow, ugh, and then I push it away because I don't want to be the kind of person that would have that thought.
I wrote a website post called Your Demons Are Robots. So there's two types of thinking in the brain. There's fast thinking and slow thinking. They call it type 1 and type 2 thinking. So what happens in type 1 thinking, your brain is designed to react to defend itself. So your brain works by association. So you're doing something really nice, all of a sudden some bizarre thought comes through and they get connected. So of course you don't like the thought, so you toss it aside. What you inadvertently did is actually gave more attention of your nervous system to that thought. So when you suppress a thought, you just gave it energy. And then it comes back again and you gave it more energy. And over 20 years or so, that thought keeps coming back and you keep pushing it aside. Well, 20 years later, it becomes one of your demons, right? So now you're talking to psychiatrists about your demons. Since you suppressed the thought in the first place, it's actually who you are not. It has nothing to do with who you are. It's a random thought that picked up power in your nervous system. So it's basically a neurological trick. So it's a bit of a story. I'm not sure how much you want to go into it right now, but the more of a high, well-intentioned person you are, the worse the process, because you have a higher chance of suppressing the thought. So everybody has unspeakable thoughts. It's part of the way the brain works. And so by simply writing down that unspeakable thought, remember you're tearing it up and instantly you've de-energized the circuit. And that's the essence. I mean, so anytime you try to control a thought or emotion, that's the essence of the problem.
Wow.
It's right there. And so, and think about this very carefully. And I came across this week, and I'm going through sort of a detailed model looking at sight, sound, feel, touch, all this stuff. So if you have something visually unattractive, you turn your vision away, right? Or if something doesn't taste good, you simply get rid of it or avoid it, right? So with all the senses, taste, sound, smell, feel, you can usually avoid the sensation to live a reasonable life. The only sensation that you can't control is thoughts. So thoughts is the opposite. So with all those other senses, as you successfully avoid the sensation, you actually are successful in decreasing the adrenaline. If you try to avoid thoughts, it actually works the opposite, right? Remember, all those other sensations can produce anxiety: sight, sound, touch, feel. Okay. And you avoid them. But with thoughts, you try to avoid those and suppress them. You actually just fire them up. So we look at thoughts as sensory input. Again, it connects you to the environment to protect you. You get a bodily response that's real. That's how we survive on this planet, is assessing situations, assessing risk, assessing benefits. Our thoughts allow us to function in this planet. We have a consciousness that animals don't. So the consciousness functions well unless the thoughts become irrational. And as you know, probably cognitive behavioral therapy, they call them cognitive distortions. With repetition, those cognitive distortions become a reality because we do them so often. So the thoughts become detached with reality, and then your life starts sort of falling apart. So that's why the entire process boils down to awareness. You become aware of your environment. You become aware these are distorted thoughts. And for some people, I mean, the essence of this whole problem is awareness, right? And there's a book that I have just been absolutely fascinated with. It's called The Way to Love by Anthony DeMello. Have you heard of this book?
No.
Oh my goodness. He's one of the most brilliant writers of all time. He's a Jesuit priest. He died somewhere in the mid-1980s, and this is his last meditations. And it's about a 2-inch book. It's just one of these really small books. And I'm telling you, he just nails this stuff right on. It's unbelievable. So he defines love as simply awareness. Anytime you're anxious, angry, or judgmental, you've lost awareness, right? And when you're in chronic pain and anxious and frustrated, you can't really see the situation very clearly. And in fact, when your body's full of adrenaline, it actually decreases the blood supply to your brain. Because remember, the only thought when you have adrenaline is survival. So it's a cascade of chemical events, again, precipitated by the different senses. But the thing in chronic pain is that pain, so when the pain circuit short circuits, it becomes its own independent factor. Remember, if you touch something painful in withdrawal, you are fine. But if your pain circuits become hypersensitive or start spinning out of control, in other words, they become their own independent circuits, you're trapped.
And that's what you were saying about when it moves to the emotional, wherever that is, the emotional center of the brain, it's the same symptom, it's the same feeling, but it's a completely different source.
Correct. So for instance, if you put your hand over a hot stove, what would happen to your anxiety? Right. So you control the situation, right?
Yeah.
So again, that's what anxiety is supposed to do. So what would happen if I grabbed your hand and I forced you to hold it over the stove? What would happen to your anxiety?
It would continue to happen. It would like go on and on. But I would think.
What would be your next emotion?
My next emotion? Oh my gosh. I don't know. I mean, I would probably faint. I would be afraid.
Right.
And well, I guess angry, right, would be the next emotion.
Yeah, right, totally. I mean, so when you're trapped by anything, you become angry. So basically, the antidote to anxiety is control, right? In other words, something causes anxiety, and you engage in a behavior to control the situation to solve the anxiety. When you lose control of the situation, like if you can't get enough food or air, you first become anxious. Then your body kicks. So then when you lose control of the situation to solve the problem, then your body kicks in adrenaline to solve the problem, right? So that's anger. So basically, anger and anxiety are the same thing. In other words, anger is loss of control. What causes the need for control is anxiety. So anger is simply anxiety on adrenaline. So what happens is that if you think anxiety causes adrenaline, anger causes a lot more adrenaline. And remember, in chronic pain, your hand is stuck over the stove, right? You're trapped. And that's, and Dr. Sarno, who did a lot of this work back in the 70s, actually, this has been around since the 20s, but Dr. Sarno used the word rage. And I mean, I was there, I did this. And when you're trapped by anything and you cannot get away, particularly with pain, which is extraordinarily unpleasant, he used the word rage, which is a supercharged nervous system And again, when your nervous system is supercharged all the time, then you're in trouble.
Wow. It's amazing. And wow, I'm just blown away. I mean, I've read books by people who are more into the spirituality aspect, but I love that you are coming at it from a completely scientific standpoint. And I love that you're not having to do you still do spine surgeries?
No, I do a lot of spine surgery. I mean, there's lots of people with tumors and infections, and people have horribly pinched spinal cords. So what's happened is that, yeah, I mean, so my surgical practice is extraordinarily complex, with spinal stenosis, deformities, trauma, tumor infection. So yeah, there's a lot of really sick people that need spine surgery. But again, what we don't do is that, again, so if somebody has, even like I had a woman this today who has spinal stenosis, and she probably needs surgery eventually, but we'll do 8 to 12 weeks to calm her down. And the surgical success rate will go from maybe 30 to 40%, or probably up to 80 or 90%. And so by just calming things down, dealing with the sleep, helping her understand pain, just the whole process, the results have just been spectacular. So we have very few surgical failures compared to what we used to see.
Wonderful.
So that's been very satisfying. And
I imagine that it helps with the healing process, because less anxiety is less inflammation too.
Right. No, I'm impressed you said that, because they've documented really well that when your body's under stress, you have adrenaline and cortisol fired up, that it changes the inflammatory response. So for instance, tennis elbow, Achilles tendonitis, plantar fasciitis are actually considered mind-body syndrome symptoms. So I don't know the data on this as well, but for instance, with the negative writing, they have found out that the negative writing has actually more of an effect on physical symptoms than mental symptoms. So asthma, arthritis, irritable bowel, spastic bladder, all those actually physically diminish with the negative writing. It's very interesting.
So the negative writing, are you doing this once, or are you doing this every week? How does that work?
I mean, it depends where you're at. I mean, I was in chronic pain for 15 years. And of course I tried everything. I was in psychoanalysis for twice a week for 13 years. That's a long time. I did self-help books. I did medications. I did everything, and nothing worked. I kept spiraling downward badly. Then I happened to read this book, Feeling Good by David Burns, and he said to start writing. So I had nothing else to do, so I started to write. For the first time in 15 years, things started to change. And of course, I didn't know why. So I wrote a lot initially. But I recommend the writing 15 to 20 minutes initially, once or twice a day. And then once you come out of the hole, maybe 5 or 10 minutes, once or twice a day. But the writing is something I've been doing for 20 years. When I quit writing, in about 3 or 4 weeks, my symptoms come back. So it's such a simple thing to do, and it's so effective. There's over 200 research papers since 1982 that document the effectiveness of the writing. I mean, there's way more research on negative writing than there is on spine surgery.
Wow. Yeah. Who knew?
So,
that's amazing.
Right. So what my dream would be is, if we really wanted to sort of change the world, is that we would put this right there into preschool and first grade. I mean, that's the place to start, because if you think about this carefully, when you go into first grade, you have a lot of anxiety anyway. Your anxiety is magnified by going to school. Then remember, the antidote to anxiety is control. The more power you have, the more control you have, right? So instead of processing anxiety in a healthy way with simple writing relaxation exercises, why we get into bullying? It's a power struggle. So what we call socialization is actually a power struggle right from the beginning. So if we put those simple writing exercises right there in the preschool and first grade on a nationwide public health basis, it would change the world. So remember, anxiety is a neurological response to the environment. It's not psychological. So once you get the correct diagnosis and put these really simple tools into place on a widespread level, I mean, the root cause of the bullying is the anxiety and the need for power. In fact, this is a very disturbing study, but there's a study out last year that showed that they drew a test called C-reactive protein, which is an inflammatory marker in the body, and elevated C-reactive proteins are considered a big problem. So they drew the C-reactive proteins of kids who were bullied, and they found a significant elevation of the C-reactive protein in kids who were bullied compared to normal kids. But what was even more disturbing is that they drew the C-reactive proteins of kids who were the bullies, and guess what? They were lower. There was a physiological benefit to having power. So if you look at the human race in general, and just look at the way we actually use it, a lot of people have in fact, every human being has a need for power. So what's sort of magical, including myself, I'm not above all this either. I get to do this on my own every day. But the magic of this whole process is once you understand that, and again, Anthony DeMello in his book, The Way to Love, really describes this, is that once you have an awareness of sort of the impossibility of actually solving your problem with more power and literally let go, it's magical. You just get to life that's free. And as David Burns pointed out in one of his seminars, is kill your ego. And you probably read Eckhart Tolle. It's the same material. It's just a different way to get into the same spot. The thing about the negative writing is that it's a very concrete, I call it mechanical meditation. When I was in my chronic pain and my mind was racing 1,000 miles an hour, I couldn't meditate. Even now, being a surgeon, I can't meditate. I just can't do it. I can write for 5 or 10 minutes. Then I do what's called an active meditation, where I just sort of relax and just feel some sensations. You would call it mindfulness. So when you go from your racing thoughts to mindfulness, you simply shifted your nervous system onto a sensation, you're off the pathways. So instead of fighting the pathways, you simply moved your brain to a different spot. So the way we start the process is we combine the negative writing, which is awareness and separation in one motion. We combine that with a simple mindfulness exercise, which I call active meditation. And that's not the final solution, but it is the core starting point. But yeah, just shifting your nervous system into a different set of pathways is huge and not very hard to do.
Once you're aware of it, because if you're in that downward spiral, you're not listening, right?
Well, for me, it's incredibly sobering because now I still plummet, right? My pathways are permanent. I was raised in a very abusive background, so I have bad pathways. They're tough. So when I actually get triggered, I go all the way back in the hole. Now, I don't stay there like I used to. I know how to get back out pretty quickly, but it's not very exciting to be there. So the pathways are permanent, and it's sort of a learned skill to keep coming back out of those. But I wasn't even aware I was in those pathways because that was my only reality, right? So it's very sobering to me to realize I live life in a very enjoyable level now, rich, full, vibrant, thriving life. And then I go into this hole, and I now realize I spent my entire life in this hole. But I didn't know, right? I had an abusive mother. And so that was my definition of love, right? That's all I knew. And I didn't know what, in fact, when I was 28 years old, I actually had to look the word anxiety up. I had a patient come in the hospital with an anxiety disorder. I didn't know what it was. I had to look the word up at 28 years old. So I was so efficient at suppressing anxiety and anger, I had no idea I was in that world because that was my base reality. And that is the biggest obstacle, by the way, to this whole process is that people get programmed by their own life, and you look at life through your own eyes. When you're judgmental on somebody, again, Anthony DeMello is very clear on this also, is that when you judge somebody as whatever, that's who you are. You're just projecting your reality onto that other person, right? So it's been a very humbling process for me, even as we speak, to understand that whole process. But the magic of it is it actually becomes rather tedious projecting your view of life onto the world. It's incredibly more interesting listening, learning, it's creativity. It's exciting. So, again, it's awareness can come different ways. Again, the writing is just one way of creating an awareness. But a lot of people come to my office just creating that awareness between pain, anger, and anxiety all of a sudden it starts making sense to them. So just that connection makes a big difference too.
Wow. Well, we have been speaking with Dr. David Hanscom. He is the author of Back in Control, a spine surgeon's roadmap out of chronic pain. And it's not just about spinal pain, it's any kind of pain, especially chronic pain, because that's when you start building those pathways and it becomes your life and starts to define you. We're running out of time here. Maybe we can have you back on the show again, because it's just been a pleasure speaking with you, and I can tell that you are a wealth of information on these subjects, neuroplasticity and mindfulness and the whole gamut. So before we close the show, is there anything that you'd like to leave listeners and viewers with?
Well, I think that I would just encourage people to keep an open mind, just simply try the tools. Just remember that you actually cannot fix yourself. The harder you try to fix yourself, the worse it gets. So this is a process of letting go and moving forward. You cannot do it in your head. You have to use what we call somatic tools to do that. And so by engaging in extremely simple tools, your brain will begin to change. So I guess my one word of hopefully encouragement is just really look at words: curious, creative, open mind. And if you find yourself simply say, this is a craziness, I'm not going to do this, it's actually a huge clue that you're the person that actually needs to engage in the process. And so again, there's many of you out there with an open mind that will try the writing relaxation. I get dozens of emails every year, actually a lot, of people that I've never met. And they say, hey, look, changed my life. I talk to people all the time. I've had incredible responses. It's about a 90% self-directed process, and you can do it on your own. Not very hard.
Wonderful. Well, thank you so much. And your website is drdavidhanscom.com. If you're watching on YouTube, I will post the link in the description below. It's drdavidhanscom.com. And just Google the name of the book, Back in Control, a spine surgeon's roadmap out of chronic pain. Thank you so much for being with us today.
Good.
I want to send all the listeners and all the viewers lots and lots of love. Hopefully, Dr. Hanscom can come back on the show again. So be well. I love you so much. Namaste.